Thank you so much, and welcome to our conference today. We're going to talk a little bit about some of the 2018 changes. Actually, it was effective on October the 1st, 2017 for home health, and some related to hospice. The updates include new, changed, and deleted codes. There are 360 new ICD-10 codes that were implemented on October the 1st. In addition, we had 141 codes that were deleted. Most of them were expanded, and 226 code titles that were revised. There have been some changes in the tabular list and also in the alpha index. There have been a few guideline changes and a few coding clinic changes. Now let's talk a little bit about the word with, or in, or due to, and it has really expanded some traditional thinking in the coding world. And so now if we see in the alpha index the word with or due to, then the classification assumes that those two things are related unless the physician says otherwise. And it, again, has expanded a little bit with as of October the 1st. So let's look a little bit at, let's say, dementia. So in the alpha index, if you look under dementia in or due to, you have a long list of items, and I've put them here as best I can. So that means that if the doctor says that a patient has HIV and they also have dementia documented elsewhere in the clinical record, then you can't, the classification assumes, unless the physician states otherwise, that the dementia is due to the HIV. And so some of these are not surprising. Alzheimer's, and we know that Alzheimer's, and the coding clinic says dementia is a component of Alzheimer's, so we do code the Alzheimer's and the dementia. But some things we may not have thought of, such as hypothyroidism. And so it's really important, because of these kind of changes, that you get a new code book every year. When we were in the ICD-9 world, it wasn't that big a deal because we had a coding freeze for the last several years of the ICD-9 implementation, and so there were changes, but they weren't huge changes. And in ICD-10 world, there are quite significant changes every year, and then as the coding clinic clarifies things quarterly. So here is the list of all of the disease processes that can be associated, unless otherwise specified by the physician, with dementia. Some expanded codes, C.diff. C.diff is an expanded code, and before October the 1st, the code for C.diff was A04.7, and now they've differentiated it and have enterocolitis due to C.diff recurrent is A04.71, and then A04.72 is enterocolitis due to C.diff not specified as recurrent. So C.diff is that anaerobic gram-positive spore-forming toxin-producing bacillus that is transmitted among humans through the fecal and oral route. You can also have antibiotic-associated colitis that leads to C.diff, and a lot of times it's recurrent. And recurrence typically occurs within a week after treatment stops. However, it can occur up to 8 weeks later. The CDC says D-CIP was estimated to cause almost 500,000 infections in the U.S. in 2011, and about 83% of the patients who developed C. diff experienced at least one recurrence, and 29,000 people died within 30 days of the initial diagnosis. So it can be a very serious thing, C. diff, unless it's controlled. They also, previously, before October 1st, had classified, if the patient was a type 2 diabetic with ketoacidosis, the coding clinic advised us to use E13.10 because it was more important to code the manifestation correctly than the type of diabetes. But with the new code set effective October the 1st, they did give us a type 2 diabetes with ketoacidosis code, and that is E11.10. And that's without a coma. It would be E11.11 with a coma. Now, the ketoacidosis will likely